Howdy. How's it going? Good day. Um, Ongoing saga of sexuality and problems, especially with mental health. That's the topic area for our week. And there's a lecture one is posted, and I wanted to immediately jump in there with a second um, bit of information about this problem with mental health, sexuality and mental health. It's kind of mind blowing. There's so many things out there that can affect our mental health, and we have a lot of research in those areas. And a lot of people don't even stop and think about the aspect of sexuality and what that and the effects of that on either good mental health or bad mental health, whatever the case is. So this is a brief discussion about sexuality and mental health and the need for development and research into that area. There's just basically not a lot of well-trained professionals that deal with this. So there's a need. There's been some movement, scientific movement in recent years, but really the fact that there's taboo that surrounds this sort of negates fast movement. It even involves interpretations and difficulty in determining what's normal and what's pathological. Is there something loose, or is this just a normal progress in this area, the sexual business, and its effect on mental health? So that's what this is all about. How do you determine whether it's a normal progression in a person's life or if there is actually some pathological involvement? Psychiatric diseases, and bear in mind that psychological problems and psychiatric problems are two different areas. You all know that. Psychiatric is the medical side. So the diseases, pathology, includes symptoms in most psychiatric problems that affect sexual life. Things like impaired desire, arousal, sexual satisfaction. These are areas that need to be researched and then properly addressed in the popular vernacular. Let's look into this and see what we can do to do it right. It's understood that sexuality is one of the stronger, if not the strongest, motivation, I guess, that we have as a human being. There's arguments about that. Survival comes into mind, escape from fear, etc. But for many years, and probably still now, the majority of scientists that study humanity feel that sexuality is obviously inherent and it's obviously powerful. And it's been around forever. It's been studied forever, particularly since the beginning of this century. And it has to do with the concerns of psychiatry related to potential pathology related to sexual mental health. Psychoanalysts discuss the importance of things like sexual repression and say that that's the origin of a lot of mental diseases, that you're repressing something that's natural. It's very obvious that repression causes mental suffering. So whatever the reason for the repression, could be religion, it could be, you name it. So the key working word is repression. The discussion rolls into limitations and the generalization of well-trained professionals in that area. So what do we mean by that? We mean that in general, we don't have enough of those folk around. Professionals that deal with research and deal in treatment are just, they're not out there. They're there, but there are not that many of them. And again, go back to what we've already talked about. This kind of taboo is a strong word, especially if you're talking about people that you would think would be beyond that, therapists, counselors. Uh, there shouldn't be any taboos, uh, and that's a repression in and of itself. If I'm thinking of this sexuality business as a taboo, then I don't need to be in this business. Does that make sense? I hope it does. So what needs to be done is some widespread movement in order to bring people into the field, and bring people into the field with enough knowledge where you can address unhealthy views of the sexual problem. Another thing that aids, or that doesn't aid, another thing that hampers this, and if we could do something about it would aid it, is the ability for people to look out into the world, social media, for example, and get information about sexuality, or view things of sexual content that have no filters, no ethical filters, or no pre-discussions about what is being viewed, how pertinent is it, and how factual is it. So we're battling on a lot of fronts here, a lot of fronts. Most of the world, as a matter of fact, even though there's plenty of online access to sexual things, most of the world, including the USA, doesn't train young people in what's termed sexology. We don't spread the word, because there are not enough of us, I guess, to prepare them for what it is that they're going to go through. This is going to begin at a young age, this preparation business, by the way. And it's not included as part of basic training. Now, there's a lot of controversy with how much should be done in the schools. We all know those things. We talked about it if you have looked at the other lecture first, then you'll see that there's a discussion about that, and what parents, even before that lecture, the ones dealing with parents' questions, what should the schools be allowed to do? What should they not be allowed to do? How should that be controlled? What kind of training needs to be incorporated to be able to make that work? Right now, sexuality is interpreted as a minor discipline within the realm of psychology, and it's usually not included in basic training. It's usually not a part, at least to a great extent, of any kind of schooling that's offered as you go through a counseling program. If you talk to someone in internship, they will tell you it's a little bit different story. That does come up rather frequently. Now, readdress something very quickly. Psychiatric diseases. They're various related to sexual symptoms, and it can even include perceptions. So to an individual, what are sexual meanings? What are their concerns? And then factor in things well known like depression, bipolar disorder, anxiety disorders, and even some psychosis. These things include symptoms that affect sexual life, impaired desire, arousal, sexual satisfaction, we mentioned already. DSM-5 has decided to recognize sexual conditions to the extent that they grant diagnostic criteria but there's a little bit of a controversy related to that. And then there's this aspect that's kind of out there, and a lot of people never even heard of it. Iatrogenic. That's when a patient, through treatment or comments by a physician, induce this sexuality problem, or the prescription of drugs, chronic use of steroidogenic, generic antidepressants, mouth isn't working. All these things have a potential of having an effect on your sexual health, particularly mental health. So one of the points I'm making here are the lack of training and the fact that we need, if you're going to pursue this area of psychology, you as a counselor need to be trained in these areas. You need to know the psychiatry and the psychology of this stuff. You need to know what you're dealing with in terms of stuff that is not very well researched yet. Maybe you're the one that's going to do the research. Who knows? So need to recognize that sexuality is part of being human, and then the research should follow. And actually, there's a word that really works well here, and that word is holistic. I remember in the 70s when I was at the University of Florida, we studied holistic existence, mental and physical working together. And this is a good example, working all together. So there you have it, some little blabberings about the fact that there's not enough training, there's not enough folk out there who are receiving the training, not enough people maybe even interested, who knows. But that needs to be addressed because there are people who are suffering out there, and they can be helped. If we have the training, we can do it. So there you have it. See you again soon.